The high cost of American healthcare, an eye-opener. American healthcare is shockingly expensive. A simple doctor's visit can cost hundreds of dollars. A hospital stay might run into thousands. This is a burden on many families. Why is this the case? Let's dive into this pressing issue. Many Americans struggle to pay their medical bills. Even with insurance, out-of-pocket costs are high. Some avoid going to the doctor to save money. This can lead to serious health problems down the line. But why does it cost so much? One reason is the price of medical services. Another is the high cost of prescription drugs. Let's not forget the administrative costs. All these factors add up. They make healthcare in the U.S. among the most expensive in the world. Understanding why healthcare is so pricey is the first step. We need to look at the history. We need to see how insurance companies operate. And we need to compare with other countries. Only then can we find solutions. The history of American healthcare dates back to the early 20th century. Before then, medical care was less formal. Doctors often worked alone, hospitals were rare, people paid out of pocket for services. There was no insurance. In the 1920s, hospitals became more common. The cost of care started to rise. Employers began offering health insurance as a perk. This was the beginning of employer-sponsored insurance. It seemed like a good idea at the time. After World War II, the government encouraged employer-sponsored insurance. Tax breaks made it cheaper for companies. This led to more people having insurance, but it also tied insurance to employment. This became a problem later on. By the 1960s, healthcare costs were rising fast. The government created Medicare and Medicaid. These programs helped seniors and low-income people, but they also added to the complexity. More laws and regulations followed. Insurance companies play a big role in healthcare costs. They negotiate prices with doctors and hospitals. They decide what treatments to cover. This gives them a lot of power. Sometimes their decisions can drive up costs. Pharmaceutical prices are another major factor. In the US, drug companies can set their own prices. This is not the case in many other countries. As a result, prescription drugs are often much more expensive. In the US, insurance companies also have high administrative costs. They spend a lot on marketing and salaries. This money does not go toward patient care. It adds to the overall cost of healthcare. These costs are passed on to consumers. The relationship between insurance companies and pharmaceutical firms is complex. They both want to make a profit. Sometimes this means higher prices for consumers. Understanding this is key to understanding the cost of healthcare. Section 4. Administrative costs and complexities. Administrative costs are a hidden driver of high healthcare prices. These include billing, record-keeping, and compliance with regulations. The U.S. healthcare system is very complex. This complexity adds to the cost. Hospitals and clinics must hire many administrators. They handle paperwork and billing. This is time-consuming and expensive. In some cases, administrative costs make up 25% of healthcare spending. This is much higher than in other countries. Insurance companies also add to administrative costs. Each insurance plan has its own rules. Doctors must spend time understanding these rules. This takes time away from patient care. It also requires more staff to handle the paperwork. All these administrative tasks make healthcare more expensive. They do not improve patient care. They just add to the cost. Reducing these costs could make healthcare more affordable, but it is easier said than done. Section 5. Comparing healthcare systems worldwide. Many countries have different healthcare systems. These systems are often more affordable. They can offer insights into how to reduce costs. Let's look at a few examples. In the UK, the NHS provides care to everyone. It is funded through taxes. There are no bills or insurance premiums. This makes it simpler and cheaper, but it also has its challenges, like long wait times. In Canada, healthcare is also publicly funded. Each province manages its own system. People can choose their own doctors. There are no out-of-pocket costs for most services. This makes healthcare more accessible. Germany has a hybrid system. It combines public and private insurance. Everyone must have insurance. The government regulates prices. This keeps costs down. It also ensures that everyone has access to care. These examples show that there are different ways to manage healthcare. Each system has its pros and cons, but they all manage to keep costs lower than in the US. Section 6. Summary of main points. American healthcare is very expensive. This has serious consequences. People struggle to pay their medical bills. Some avoid going to the doctor. This can lead to worse health outcomes. The history of healthcare in the US is complex. It started with employer-sponsored insurance. Government programs like Medicare and Medicaid added to the complexity. This history has shaped the current system. Insurance companies and pharmaceutical prices are major factors. Insurance companies have a lot of power. They negotiate prices and decide on coverage. Drug companies can set their own prices. This leads to high costs. Administrative costs add to the expense. The US healthcare system is very complex. This requires a lot of administrative work. These costs are higher than in other countries. They do not improve patient care. Comparing with other countries can offer insights. Systems like the NHS in the UK or Canada's public healthcare are more affordable. They have their own challenges, but they manage to keep costs lower than in the US. Section 7. Possible solutions to the healthcare crisis. Reducing healthcare costs is a big challenge, but it is not impossible. There are a few potential solutions. These could make healthcare more affordable for everyone. One solution is to reduce administrative costs. Simplifying the system could help. This would mean less paperwork. It would free up time for doctors. This could lead to better patient care and lower costs. Another solution is to regulate drug prices. Many countries do this. It keeps prescription costs down. The US could learn from these examples. This would make medications more affordable. Expanding government programs could also help. Medicare for all is one idea. This would provide healthcare to everyone. It would be funded through taxes. This could simplify the system and reduce costs. These solutions are not easy. They will require political will and public support, but they offer a way forward. Making healthcare more affordable is possible. It is a goal worth pursuing.